Have you ever pondered the meaning behind a persistent itch, casually dismissing it as mere dry skin or a fleeting irritation? What if I told you that for older individuals, particularly those over the age of 60, an unexplained sensation of itchiness in certain body areas could be a hushed precursor to a grave illness, such as cancer, long before other symptoms manifest? We are going to reveal 5 specific itchy areas that might indicate a deeper underlying issue, supported by compelling real-life narratives and crucial medical insights. If you're watching this video, comment "Stop Cancer" right now. You absolutely must continue watching until the end to fully grasp the implications of these particular itches, discern the difference between a benign annoyance and a concerning signal, and understand the proactive measures you can take to safeguard your well-being. Recognizing these subtle cues could genuinely be a matter of life or death. Before we delve into this vital information, I would be profoundly grateful if you would show your support by giving this video a thumbs up. Your engagement helps us disseminate these essential lessons concerning senior health far and wide. If you haven't yet subscribed to our channel, I wholeheartedly encourage you to do so and activate the notification bell, ensuring you never miss our illuminating future content. Now, let's commence this insightful journey. 1. Unrelenting itching on the lower extremities. For older adults, an incessant itch confined to the lower legs, particularly the shins and calves, can easily be brushed off as a minor nuisance, readily ascribed to the natural aging process of the skin, environmental influences, or even the friction from new hosiery. However, when this itch persists without any accompanying rash, noticeable dryness, or an obvious instigating factor, such as a new soap, lotion, or laundry additive, it might signify something more profound than a simple dermatological irritation. This particular symptom has gained increasing recognition as an early warning sign in individuals subsequently diagnosed with blood-related malignancies, most notably lymphomas, such as Hodgkin lymphoma. Unlike the transient itch brought on by parched skin or superficial irritation, this sensation is relentless, frequently intensifying during nocturnal hours, and stubbornly resistant to conventional remedies like hydrating creams or antihistamines. The underlying mechanism linking this specific itch to cancer lies in the intricate interplay between the disease's progression and the body's immunological response. Lymphomas originate within the intricate lymphatic system, a crucial network responsible for immune defense and maintaining fluid equilibrium throughout the body. As malignant lymphocytes proliferate, they release potent inflammatory chemicals, known as cytokines, into the bloodstream. These circulating cytokines can irritate nerve endings situated deep within the skin, triggering a profound, sometimes searing itch that feels as though it emanates from within the very fabric of the body, rather than merely from its surface. The lower extremities, with their dense array of sensory nerves and relatively delicate skin, appear particularly susceptible to this phenomenon, making them a common locale for this symptom to manifest. Consider the compelling experience of Mr. David Rodriguez, a 75-year-old retired architect from Phoenix, Arizona, who recounted his ordeal at a recent community health seminar. For nearly 6 months, his sole complaint was an unyielding itch spanning the front of his legs. Initially, he dismissed it as an eccentricity of advancing age, or perhaps an allergic reaction to a recently changed laundry detergent. His family physician, equally unaware of the deeper implications, initially prescribed a topical corticosteroid cream for suspected eczema. Yet, the persistent itch only intensified, becoming agonizingly worse at night and severely disrupting his sleep. It wasn't until routine laboratory analyses revealed an elevated white blood cell count, subsequently followed by advanced imaging studies that detected enlarged lymph nodes within his chest cavity, that Mr. Rodriguez received a diagnosis of Hodgkin lymphoma. Reflecting on his arduous journey, he poignantly remarked that the insidious itch had been his body's earliest, and for many months, only indication of the burgeoning illness. This pattern is far from isolated. While certainly not every itch signifies a cancerous condition, the distinguishing characteristics of this particular itch are its unwavering persistence and its resolute unresponsiveness to conventional treatments. Unlike typical cutaneous irritations caused by dehydration, allergic reactions, or external irritants, this specific itch conspicuously lacks visible signs such as redness, flaking, or a discernible rash. For older adults, whose physiological systems may not always articulate distress as overtly as younger individuals, this subtle distinction is critically important. The aging process can indeed blunt the body's capacity to manifest clear, unambiguous symptoms. Overt pain may be conspicuously absent, and palpable lumps may be situated too deep to be detected in their nascent stages. Nevertheless, the delicate nerve network remains acutely sensitive, and a persistent, unexplained itch can serve as an early, hushed warning of impending trouble. If this relentless itching is accompanied by other subtle, yet concerning indicators, such as drenching night sweats, inexplicable and pervasive fatigue, unintentional weight loss, or palpable enlargement of lymph nodes, it is imperative to promptly consult a healthcare provider. Do not hesitate to request a comprehensive medical evaluation, which should include blood tests, such as a complete blood count CBC, and potentially advanced imaging studies, to definitively rule out any underlying systemic conditions. The human body frequently communicates its distress through quiet, almost imperceptible signals, and for older adults, attuned listening to these subtle biological whispers can be profoundly life-saving. Comment early signal if you understand the importance of recognizing these subtle cues. 2. Unrelenting itching between the shoulder blades or upper back. Another subtle, yet potentially profoundly significant, symptom is a persistent itch localized specifically to the upper back, particularly the region situated directly between the shoulder blades. For a multitude of older adults, this sensation is all too easily dismissed as a mere consequence of dry environmental air, poor postural habits, or even the irritating presence of a clothing tag. However, when this itch feels uncharacteristically deep, almost as if it originates from beneath the dermal layers, and stubbornly persists despite the diligent application of topical treatments, it may strongly suggest an underlying systemic issue, most notably pancreatic cancer. Remarkably, this enigmatic itch can manifest many months before the more classical and widely recognized symptoms of pancreatic cancer, such as debilitating abdominal pain, characteristic jaundice, yellowing of the skin and eyes, or significant digestive disturbances. This makes it an extraordinarily critical early warning sign that should never be overlooked. A precise connection between pancreatic cancer and an itch in the upper back may initially appear counterintuitive, given that the pancreas itself is anatomically located deep within the abdominal cavity. However, the underlying mechanism is firmly rooted in the malignant tumor's impact on the body's intricate bile drainage system. Pancreatic tumors, even those of relatively small size, can gradually obstruct the delicate bile ducts, which are responsible for transporting bile, a digestive fluid produced by the liver, to the intestines, where it aids in the digestion and absorption of fats. When these vital ducts become blocked, bile salts, which are components of bile, begin to accumulate excessively within the bloodstream, leading to a pathological condition known as cholestasis. These surplus bile salts can then deposit themselves within the skin, particularly in areas richly supplied with sensory nerve endings, such as the upper back. The consequence is a deep-seated, intensely nagging itch that feels distinctly internal rather than superficial. It is frequently described as a phantom sensation that resolutely defies any form of relief, even from vigorous scratching. Consider the poignant case of Miss Harriet Jenkins, a 70-year-old grandmother from Denver, Colorado, who endured this exact symptom. For many months, she was relentlessly plagued by an excruciating itch situated precisely between her shoulder blades, an itch so severe that it would frequently rouse her from sleep each night. She exhaustively attempted every conceivable remedy, various moisturizing creams, a spectrum of antihistamine medications, and even meticulously altering her mattress and bedding. Yet, absolutely nothing provided even a modicum of alleviation for the distressing sensation. She vividly described it as feeling as though it was coming from inside my very core. When she eventually visited her physician for unrelated complaints of increasing fatigue, routine blood tests providentially revealed abnormally elevated liver enzyme levels, which justifiably prompted further, more detailed investigation. A subsequent abdominal computed tomography CT scan ultimately uncovered a small but significant tumor located within the head of her pancreas, which was exerting pressure on the crucial bile duct. At that critical juncture, Miss Jenkins experienced no pain whatsoever, exhibited no signs of jaundice, and reported no digestive complaints. Her sole symptom was the persistent, perplexing itch. Her early reporting of this seemingly minor and atypical symptom proved instrumental, leading to a diagnosis at a stage when effective treatment remained a viable option. This particular itch is markedly distinct from generalized back irritation caused by external factors like dry skin or localized friction. It is characteristically highly localized, often centered with uncanny precision between the shoulder blades, and remarkably resistant to conventional treatments. For older adults, who may be understandably hesitant to voice what they perceive as seemingly trivial complaints, this symptom's specificity is paramount. Additional accompanying signs, such as urine that appears uncharacteristically darker than normal, stools that are unusually pale, inexplicable and significant weight loss, or persistent, debilitating fatigue, should dramatically heighten concern and prompt immediate medical attention. If you or a beloved family member observes an itch in this specific area that simply will not abate, especially if it feels deep-seated or is accompanied by any of these other aforementioned symptoms, consult a medical professional without delay. Request comprehensive blood tests to meticulously assess liver function and seriously consider advanced imaging studies, such as an ultrasound or a CT scan, to thoroughly investigate potential internal causes. The upper back, though physically distant from the pancreas, can indeed act as an unlikely but crucial messenger, and heeding its signal can genuinely make a critical, life-altering difference. Comment crucial if you find this information invaluable. I believe you're enjoying this video. Before we continue, make sure you subscribe, like, and share this video. Comment wonderful if you're enjoying this video. 3. Itchy scalp without visible flakes or dandruff. An itchy scalp is an exceedingly common complaint, frequently attributed to arid atmospheric conditions, abrasive hair care products, or the natural thinning and drying of skin that accompanies advancing age, particularly among older adults. However, when the itching sensation relentlessly persists without any discernible visible signs such as dandruff, redness, or flaking, and instead feels more akin to a tingling, crawling, or burning sensation, it may well signify a deeper, underlying medical issue. In certain cases, this particular symptom has been definitively linked to blood-related malignancies, such as leukemia, or even various forms of skin cancers affecting the scalp. For individuals over 60 years of age, whose skin and intricate immune systems undergo natural physiological transformations, this specific type of itch can serve as a nascent clue to underlying pathology. The distinctive nature of this itch lies in its profound resistance to conventional treatments. Unlike typical scalp irritation triggered by dryness or sensitivity to specific hair products, this sensation frequently feels distinctly neurological, often described as a prickling or burning that seems to shift capriciously across the scalp and steadfastly persists despite the diligent application of moisturizing oils, specialized anti-dandruff shampoos, or significant lifestyle modifications. In the context of leukemia, particularly chronic lymphocytic leukemia CLL, this persistent itch may originate from aberrant immune activity. As leukemia cells aberrantly proliferate within the bloodstream or bone marrow, they can trigger systemic inflammation throughout the body, releasing a cascade of chemicals that exquisitely irritate nerve endings embedded within the skin. The scalp, with its exceptionally high concentration of sensory nerves, is particularly prone to manifesting this neurological irritation. Consider the illustrative case of Mr. Robert Miller, a 73-year-old retired educator from Chicago, Illinois, who personally experienced this perplexing phenomenon. For many months, he noticed a peculiar and persistent itch on his scalp that struck him every afternoon with uncanny regularity, almost like clockwork. Initially, he suspected his shampoo or even his cherished wool cap. He meticulously switched to hypoallergenic hair products and completely ceased wearing hats. Yet, the relentless itch persisted, which he described as a maddening, crawling sensation that no amount of scratching could ever truly relieve. During a routine medical checkup, prompted by his increasing and unexplained fatigue, his physician astutely ordered a complete blood count, which startlingly revealed abnormally elevated white blood cell levels. A subsequent bone marrow biopsy definitively confirmed an early stage of CLL. For Mr. Miller, the enigmatic scalp itch was his body's earliest, and for a significant period, its only signal of the insidious disease. Beyond leukemia, persistent scalp itching can also serve as an early indicator of various skin cancers, such as basal cell carcinoma or squamous cell carcinoma, particularly in older adults who exhibit thinning hair or scalps frequently exposed to the sun's harmful ultraviolet rays. These specific cancers may initially present as small, itchy patches that deceptively resemble dry skin or a minor irritation, but stubbornly fail to resolve with time or standard treatments. Because the scalp is inherently challenging to self-examine comprehensively, these subtle changes can unfortunately go unnoticed without external assistance. Regular inspections by a trusted partner, a dedicated caregiver, or a professional hairdresser, ideally performed under excellent lighting conditions, can prove invaluable in identifying any suspicious areas that warrant further investigation. For older adults, the primary challenge lies in accurately distinguishing this type of itch from the expected and often benign skin changes associated with normal aging. Dryness and heightened sensitivity are indeed common occurrences, but a cancer-related itch distinguishes itself by its unwavering persistence, escalating intensity, and notable lack of response to conventional treatments. If the itch lingers for weeks, feels unusually peculiar or intense, or is accompanied by other concerning symptoms such as pervasive fatigue, easy bruising, recurrent or frequent infections, or unexplained weight loss, it is absolutely imperative to take immediate action. Consult a healthcare provider without delay and request a thorough medical evaluation, which should include comprehensive blood tests and, if deemed necessary, a referral to a dermatologist for a meticulous scalp examination or a biopsy of any suspicious lesions. For concerns related to potential skin cancer, a qualified dermatologist can expertly utilize specialized tools, such as dermoscopy, to precisely assess any suspicious areas. The scalp, though frequently overlooked in routine self-examinations, can indeed be a critical messenger, and paying meticulous attention to its signals can uncover a profound story that your body is desperately trying to communicate. Listen to your body if you agree. 4. Localized itching on the chest or breast area. For older adults, particularly those navigating their 60s, 70s, or beyond, noticing a persistent itch within the chest or breast region, especially around the nipple area or directly beneath the breast, can initially seem like a minor annoyance. It is entirely tempting to ascribe it to everyday, benign causes: perspiration from a warm day, irritation from a close-fitting garment, an allergic reaction to a newly introduced detergent, or even the natural thinning of the skin that accompanies the aging process. However, this specific anatomical area of the body is, regrettably, one of the most frequently overlooked when it comes to recognizing symptoms that could potentially point to something far more serious, such as inflammatory breast cancer, other forms of breast cancer, or even tumors developing in proximity to the chest wall. What fundamentally distinguishes this particular symptom is its inherent subtlety and its disconcerting tendency to appear long before more overt and widely recognized signs, such as a palpable lump. The itching sensation is often highly localized, meaning it occurs in one very specific spot and does not migrate or spread across a larger anatomical area. The skin within that precise spot might feel uncharacteristically warm, overtly irritated, or even unusually tight, as though it is being stretched from within. In some instances, there are discernible visible changes to the skin's appearance, perhaps a subtle roughness, a noticeable thickening that feels distinct from the surrounding healthy tissue, or a reddish or pinkish discoloration that stubbornly refuses to fade. However, just as frequently, there is absolutely nothing visually discernible, merely an unrelenting itch that persistently defies all attempts to soothe it with readily available over-the-counter creams, lotions, or even fundamental changes in clothing or personal hygiene routines. Consider the compelling experience of Miss Clara Bellwether, a 69-year-old retired librarian from Seattle, Washington, who began noticing an unusual and persistent itching sensation specifically around her right breast. At first, she logically assumed it was a minor irritation, possibly caused by the underwire of her bra or an allergic reaction to her new laundry detergent. She diligently tried switching to softer, more breathable fabrics, opting for hypoallergenic soaps, and even going without a bra for several days at a time, convinced that friction was the primary culprit. Yet the persistent itching remained, always localized to the exact same spot, day after day, sometimes intensifying dramatically at night. After several weeks of this frustrating persistence, Miss Bellwether mentioned it almost casually during a routine medical checkup. Her physician, exercising admirable caution and taking no chances, meticulously examined the area and astutely noted subtle dimpling in the skin near the site of the itch, a concerning hallmark of potential underlying trouble. Subsequent diagnostic imaging and a biopsy later tragically revealed a small but aggressive tumor growing just beneath the skin's surface, one that did not present as the classic round lump most commonly associated with breast cancer. Miss Bellwether's proactive and early reporting of her symptoms likely saved her life, but her story powerfully underscores how remarkably easy it is to casually dismiss such a seemingly innocuous symptom. Inflammatory breast cancer, in particular, is a rare but exceptionally aggressive form of the disease that regrettably does not always adhere to the typical patterns observed in other breast cancers. Unlike its more common counterparts, it may not form a distinct, palpable lump. Instead, it causes diffuse changes in the breast tissue that can deceptively mimic a simple skin infection or a common rash. The persistent itch can indeed be one of its earliest and most insidious signs, frequently accompanied by an unusual warmth, noticeable swelling, or a profound sensation of heaviness within the affected breast. Because this form of cancer tends to spread with alarming rapidity, early recognition and prompt intervention are absolutely critical. This specific type of cancer accounts for only a small percentage, approximately 1% to 5% of all breast cancer cases. But its swift progression makes it disproportionately deadly if not diagnosed and treated in its nascent stages. For men, the inherent risk of breast cancer is even more readily overlooked due to societal perceptions. Male breast cancer, though exceedingly rare and accounting for less than 1% of all breast cancer cases, is nevertheless a very real and concerning possibility, particularly for men over the age of 60. Men may not instinctively think to regularly monitor their chest area for subtle changes, and an itchy patch near the nipple, a small area of thickened or scaly skin, or a vague discomfort beneath the chest muscle can be all too easily dismissed as insignificant. Yet, these seemingly minor manifestations can indeed be potent early warning signs. Men, just like women, may also experience alarming skin changes such as redness, characteristic dimpling, or even nipple inversion, all of which unequivocally warrant immediate and thorough medical attention. Beyond the ominous specter of breast cancer, persistent itching in the chest or breast area can also signal other serious medical conditions. Enlarged lymph nodes situated in the armpit or in close proximity to the collarbone, for instance, could potentially indicate lymphoma or another form of malignancy that is exerting pressure on nearby tissues, thereby triggering irritation or localized inflammation. In some instances, the persistent itch may be subtly accompanied by a mild swelling, a sensation of persistent fullness, or even a faint, elusive ache that is notoriously difficult to pinpoint with precision. These symptoms are frequently so mild and insidious that they are routinely ignored. but they can nevertheless be your body's urgent way of signaling that something is profoundly amiss. The paramount takeaway message here is unequivocally clear. An itch in the chest or breast area that persists for several weeks, remains stubbornly confined to one specific spot, and resolutely fails to respond to typical remedies like moisturizers or antihistamines, absolutely deserves immediate and thorough medical attention. Early detection of serious conditions like cancer does not always exclusively rely on advanced imaging technologies or complex laboratory tests. More often than not, it begins with an astute and attentive awareness of your body's subtle signals. Your skin, though lacking a conventional voice, possesses an uncanny ability to communicate distress in nuanced and often overlooked ways. An itch in this sensitive anatomical area is one such signal that you simply cannot afford to ignore, for your health and potentially your life depend on it. If you are still watching this video and finding these lessons useful, please comment early detection below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Persistent itching in the anal or genital area. Few symptoms are as inherently uncomfortable or as frequently dismissed as persistent itching in the anal or genital region. For older adults, particularly those over the age of 60, this often proves to be an exceptionally awkward topic that is all too readily swept under the rug, primarily out of embarrassment or the casual assumption that it signifies nothing genuinely serious. It is remarkably easy to attribute such an itch to a myriad of benign and commonplace causes: inadequate hygiene, irritation stemming from abrasive toilet paper, friction caused by ill-fitting clothing, an allergic reaction to certain soaps or incontinence products, or even a minor fungal infection like a yeast overgrowth. And in many instances, these are indeed the accurate culprits, providing a straightforward explanation for the discomfort. However, when this intense itching stubbornly persists for weeks or even many months, returning relentlessly despite diligent hygiene practices, consistent application of topical treatments, or significant lifestyle adjustments, it could very well be an early and critical warning sign of something far more serious, such as anal, vulvar, or penile cancer. What makes this particular symptom so exceptionally deceptive is its uncanny ability to masquerade convincingly as something utterly trivial. The itch may commence subtly, perhaps noticeable only at specific times of the day or after particular activities, such as prolonged sitting. Over time, however, it invariably becomes more persistent, sometimes escalating into a raw or searing sensation that feels distinctly deeper than mere surface-level irritation. The skin in the affected area might undergo subtle changes in texture, becoming noticeably rougher, unusually thinner, or slightly discolored with a reddish, whitish, or even darkened appearance. In other instances, there are no visible changes whatsoever, just an unyielding itch that adamantly refuses to relent, regardless of how much cream, powder, or meticulous care is applied. Take, for instance, the compelling example of Mr. Arthur Peterson, a 76-year-old widower from Houston, Texas, who spent nearly an entire year battling what he mistakenly believed was hemorrhoid-related discomfort. He exhaustively attempted every conceivable remedy known, various over-the-counter hemorrhoid creams, meticulous dietary changes aimed at reducing irritation, soothing sitz baths, and even applying cold compresses to alleviate the area. Yet, the excruciating itching in his anal region relentlessly persisted, always localized to the exact same spot, sometimes even rousing him from a deep sleep in the dead of night. Frustrated and utterly exasperated, he finally sought out a colorectal specialist who performed a comprehensive scope examination and, to his dismay, discovered a small, suspicious lesion on the wall of his anal canal. Biopsy results regrettably confirmed an early-stage anal cancer, a rare but thankfully treatable condition when identified in its nascent stages. Mr. Peterson's story powerfully highlights how effortlessly such a critical symptom can be misattributed and how absolutely paramount it is to trust your innate instincts when something persistently feels profoundly amiss with your body. For women, vulvar cancer, Although relatively rare with approximately 6,000 cases diagnosed annually in the United States, represents another significant concern, particularly for those over the age of 60. One of its earliest and most common signs is a chronic, unrelenting itch on or near the vulva, frequently occurring without the presence of a visible lump. The skin in the affected area may feel noticeably rougher or unusually fragile, sometimes presenting with subtle discoloration or small, bothersome sores that stubbornly fail to heal. Many women mistakenly attribute these distressing symptoms to postmenopausal dryness, hormonal fluctuations, or irritation from sanitary pads or underwear, leading to an often dangerous delay in seeking appropriate medical care. But a relentless itch, especially if it intensifies during the night or remains strictly confined to one specific area, should unequivocally never be ignored. Similarly, penile cancer, though exceedingly rare with roughly 2,000 cases reported annually in the U.S., can present with persistent itching or irritation on the penis, particularly around the glans head of the penis or foreskin. Men may unfortunately mistake this for a minor irritation or a common infection, but if the symptom lingers stubbornly despite diligent treatment, it warrants a much closer and immediate medical examination. The anal and genital regions are remarkably rich in sensory nerve endings, rendering them exquisitely sensitive to even subtle internal physiological changes. Persistent itching in these highly sensitive areas can signal not only localized cancers, but also broader systemic issues such as inflamed or enlarged lymph nodes in the groin area, which could potentially point to lymphoma or even metastatic spread from another, more distant malignancy. In some instances, the persistent itch is accompanied by other subtle yet concerning signs: a vague feeling of pressure, slight but noticeable swelling, or even an alteration in normal bowel or urinary habits. These symptoms are often so mild and fleeting that they are easily dismissed, particularly when they tend to come and go intermittently. The single biggest barrier to effectively addressing this crucial symptom is often pure hesitation. Many older adults experience profound embarrassment when discussing such a deeply personal and intimate issue, fearing they will be perceived as overreacting or, even worse, wasting a doctor's valuable time. However, silence in this context can prove to be far more perilous than discomfort. Speaking up about a chronic and unexplained itch in the anal or genital area could be the very action that leads to the early detection of a serious medical condition, thereby significantly improving treatment outcomes and ultimately offering invaluable peace of mind. The bottom line is straightforward and unambiguous. If the itching persists for several weeks, steadfastly fails to respond to standard over-the-counter treatments, and feels distinctly localized or unusually intense, absolutely do not assume it is a normal part of aging or a minor irritation. Schedule an appointment immediately with a qualified healthcare provider, whether it be your primary care physician, a dermatologist, or a specialized expert like a colorectal or gynecologic specialist. Early detection of serious conditions often begins with the simple yet profound act of noticing the small, subtle signals your body is sending and, crucially, having the courage and conviction to act decisively upon them. Comment proactive if you commit to being proactive about your health. Thank you for investing your precious time in watching this comprehensive video on the 5 specific itchy spots that could potentially signal something genuinely serious like cancer, and how to accurately recognize when your body is diligently trying to communicate a vital message to you. Your body is a remarkably intelligent and constantly communicating entity, and sometimes it is the smallest, most stubborn signs, like a persistent itch, that carry the most significant and life-altering messages. We sincerely hope that this video has thoroughly empowered you to attentively listen to those quiet, often overlooked signals and to take decisive action when something simply feels profoundly off. What profound insights have you gleaned from this video so far? Please take a moment to share one significant thing you've learned and how you plan to integrate this newfound knowledge into your daily life. Drop your thoughts in the comments section below, because your thoughtful insights not only inspire us, but also provide invaluable encouragement to countless others. If you found this video genuinely helpful, Please make sure to leave your valuable comment below, and crucially, do not forget to smash that like button. Share this vital information with your loved ones, and subscribe to our YouTube channel for even more empowering content designed to inform and uplift you. Thanks for being here, and we eagerly anticipate seeing you in our next illuminating video. Remember to subscribe, like, and share. And before you go, be sure to explore the other fascinating and informative videos available on our channel. You might just discover something else that could change your life.